Gastric paresis, diabetes, need to lose weight. So how do you manage that particular case? So let me share some insights from an internal medicine, obesity medicine doctor. I'm Dr. Kurt Reyes. So I had a patient who lost or needed to lose weight, but unfortunately he could not tolerate GLP-1 receptor agonists. And difficult case is diabetes poorly controlled. So I took this approach with this patient, and this is what it takes to have the expertise to meet with someone who knows what they're doing and understands the disease. Number one, this person needed to build muscle. And this is one of the few times, I don't really like doing insulin very often in my patients with diabetes, but this is one of the few times that I did not have many other options because of the complications in the medical history. But I sold it to the patient. This is your opportunity to grow muscle. So we had the person eat sufficient amount of carbohydrates, inject insulin, build muscle. He's bench pressing a pretty good impressive amounts, working out with 205 at this point. And so now his A1C has normalized. I forgot what the starting was, but it was poorly controlled enough. Usually above 8 is when I start thinking about insulin, but I will only do insulin in patients who are going to commit to resistance training, because insulin in a diabetic patient without resistance training equals more adipose tissue, more visceral fat, more subcutaneous fat, and that patient will gain nothing but pure fat in that situation. So I will not do it unless that patient commits to resistance training. This is exactly what he did, and he put his diabetes, or he put the A1C into the normal range, and we're going to see hopefully in the next check it's going to be normal again, or even lower. Hopefully it'll reach the low 5 percentile, 5% area, and he's going to do really well with it. And he's I forgot to mention, he's not on insulin anymore. So we use insulin as a growth hormone to grow some skeletal muscle, right? And then he grew it, got stronger, cut it off. You know, Dexcom showed 98% time in range. I think that's pretty good. See you at the next video. Ooh, I went a little bit long, but I'll see you at the next video.